This is Dr. Cruz from Kentuckiana Integrative Medicine, and we are interviewing, please say your name.
Dona Langevin.
And Donna, is it okay if we put this video on the internet and our website?
Yes.
Can you tell us why you came to our clinic?
Well, I had surgery, Dupuytren's disease surgery, and the surgeon shortened, or this is what he did to my hand.
Right.
This is the end result.
So you had on the same day, you told me carpal tunnel release and Dupuytren contracture release surgery. And then after the bandages came off, you ended up with complex regional pain syndrome of your left hand.
That's correct.
And thankfully you're right-handed. And you told us your pain level was a 7 and that you couldn't close your hand completely.
Right.
And it was quite painful. And was it constant pain or comes and goes?
No, it's constant pain.
Okay. So now you came to us to get ketamine therapy and neridronate or pamidronate equivalent therapy. And tell us how you felt when you first came compared to now.
Well, I was a little skeptical at first, but after the first session, I felt better about it, and I can work my hand a lot better now than I did.
So at first, Donna couldn't make a complete fist, and show the folks what you can do with your hand now.
So now, of course, the fingers are still like this, but I could not do this.
So you can see she's touching, all of her fingers touch the base of her hand, which she couldn't do before. And now she's even grabbing her husband's hand. And so we're much more optimistic. And her pain score went from a 7 to a 4 or 5, which doesn't sound that much, but she's a lot more functional and her fingers are moving much better with less pain. Do you have any thoughts, doctor?
Well, we didn't get any relief from anybody else, and we started looking around, and I went on and found the treatment forms for this in Italy and the European treatment, and they're not approved here, and so by the FDA. The drugs are, but not for CRPS. And then we found your website, and I started reading that and cross-referenced everything I could, and I did a pretty good search, and that's why we ended up coming, because it looked like a promising thing and that we would get some relief finally from somebody.
Great. And so far, so good. So, and this is Miriam, our physical therapist, who's been helping Donna. What thoughts do you have?
Yes, when I first assessed her, she had some significant restriction in a nerve that goes down the front of the arm into the palm, which wasn't unexpected because of the scarring and things there. And she would get a magnification of her symptoms of that, quote, raw burning feeling, particularly into that index finger the first day. As of today, she can get that full motion by herself all the way out to the side, wrist pulled back, and it didn't aggravate any of her symptoms, did not make the baseline pain any worse. She also has some symptoms on the back of the hand, and today she was able to do the radial nerve, which is this position, taking the arm back, the wrist down, fingers closed, now that she can close her fingers, and there's no restriction there. So in the PT world, that's extremely significant, because without that nerve being able to flex and move, it will aggravate the symptoms. So I gave her a home program to do that, and also, she's going to use some topical things to help improve the circulation, because the palm was quite white on that left-hand side compared to the other one, so there was some circulation restriction.
Right,
so,
probably from the fibrosis.
Probably from the fibrosis where the scars are. Yeah.
So she's had CRPS for 6 months, right? 12 months. So in 4 days with ketamine therapy and pamidronate, she's a lot better. And Miriam is describing that the radial nerve and the median nerve are much better, because you couldn't move as far before as you can now. So thank you, all of you, for the interview, because this helps other people believe in us.